Top 7 signs and symptoms to look out for if you're wondering if you have hip impingement, or if you just wanted to understand how patients and individuals with hip impingement present. So keep tuned and let's go. Now, hip impingement, there are some absolute cardinal signs to consider here, and we're going to go through the top 7 things that I really want you to consider. All top 7 are really, really vital, so make sure that you stay right to the very last one to make sure that you don't miss some of the most important signs and symptoms. Now, firstly, individuals who have hip impingement or FAI syndrome, number 1, commonly will present with symptoms around this area. So it's reported as a C sign of pain. They'll obviously often get their hand, put it to the top of the pelvis around this area, and sometimes report that they've got pain around the top of the front of the hip and around the pelvis. Now, that progression is the other key thing here. That's point number 2. The history, the narrative, the story is absolutely key. These are the cues that the patient and the individual will always say. I'll give you an example. Often the hip will present as a bit of tightness, as a bit of stiffness. Maybe it's always felt a little bit tighter in the groin on that side. But things have progressed. It's progressed from a tight hip into becoming quite painful, to the point where function and ability to perform sport or activity starts to diminish and pain levels start to increase. And that's often over a period of months and months and months, if not years. So number 2, the history, the story, the narrative is really key with this. Point number 3, a stiffness of the hip or a loss of range of movement is something absolutely key to not forget. Often patients who have FAI syndrome or hip impingement will report a loss of range of movement into internal rotation and into hip flexion. So when someone's bringing a hip up to their chest, they'll often report that that feels quite painful, acute, sharp catching, and obviously alongside that, a little bit stiff as well. And they'll notice a loss of hip internal rotation as well. As things progress, they potentially might even find sitting cross-legged or putting their ankle on their knee to sit with an external rotation may also be restricted as well. So a loss of range of movement and a stiffness is absolutely key here to consider. Number 4, hips sometimes click, and they often can be quite benign and pain-free, but with hip impingement, often patients will report that they have clicking or snapping at the front of the hip. Now, this is often a bit of tendon flicking over a little prominence at the front of the hip, but it can be quite painful, and often it's reported that pain is there when legs are being lifted or lowered. So you could think abdominal training like leg lowers or even abdominal crunches with a decline can elicit that kind of clicking and painful response. So something to really consider with that. Point number 5, sometimes stride length can be reduced. So because of the painful hip at the front, often these hips will find it bringing the hip backwards. So when you're walking, having the leg go behind you can feel a little bit stiff. And over a period of time, hip with hip impingement, or I should say hips with FAI syndrome, might over a period of time require or adapt. The last 2, do not forget, but before we do that, just to let you know, there's loads more videos coming, loads of different hip conditions and loads of real good, hopefully quality educational videos. So subscribe so you don't miss out. Now, the last 2, prolonged sitting. Patients and individuals with hip impingement often find that keeping the hip in that flex position in a deep seat can often cause symptoms to come about. So things like driving for long periods or sitting at the desk can really start to irritate the hip and brings on symptoms that can be a problem for patients. And number 7, and definitely one that I wouldn't say to forget or disregard, but something you'll often come across, is those who play sport activity, go to the gym, will often report a reduction in squat depth. A lot of this comes down to the difficulty separating the way that your lower back and your pelvis and your hip move due to the stiffness and the fact it's probably progressed over a period of time. So those who are squatting often find that the hip not only hurts to go into deep flexion, but they just generally have a reduction in squat depth. So these are the 7 cardinal things to try and consider. Also, if you're a patient individual with hip pain, trying to work out whether or not you might have symptoms that are hip impingement related, these were hopefully the top 7 that you find useful. And if you found this video useful, let me know in the comments. I want to hear from you guys as well, and hopefully see you there for the next videos.